Sleep maxing, a new wellness trend that aims to maximize the amount and quality of sleep you get each night, is going viral on social media. Influencers promoting advice, products, and practices aimed at improving your sleep. They're racking up hundreds of thousands of views. Experts are sounding the alarm, though, as some aspects of sleep maxing can actually raise health risks. Dr. Nidhi Kumar is on call to tell us more about all of this. Good morning.
Good morning.
So everybody's looking for a better night's sleep. What is sleep maxing?
Okay, the newest trend, of course, all over TikTok, where people are trying to maximize the amount that they are sleeping every night, using pills, using potions, using different devices to try to sleep.
How many hours a night should people be sleeping?
Well, it depends. So middle schoolers, about 9 to 12 hours a night. High schoolers, 8 to 10 hours a night. I mean, how many high schoolers are really sleeping that much? And adults, greater than 7 hours a night. We are a country that is chronically sleep deprived.
Yeah, and it's so important to get sleep. There are so many benefits to an adequate night's sleep. Tell us about those.
Absolutely. So less sick days, because it really boosts your immune system. Better weight control. You know, when you're not sleeping, you have higher levels of cortisol, weight tends to stick. Lower rates of heart attack, stroke, lower rates of diabetes, lower rates of high blood pressure, better mood, better attention, less stress, less anxiety. It's worth getting to bed earlier.
Sounds it, for sure. So what are some of the sleep maxing trends that you're seeing that are being promoted, and do any of them actually work?
Okay, so one of the big parts of sleep maxing is tracking your sleep. But the problem with tracking your sleep and wearing these sleep trackers is it can become somewhat obsessive, and people can actually start developing an anxiety about trying to get to sleep. The other big piece of this is mouth taping. And I'm going to say a hard no to mouth taping. It can actually be quite dangerous. It can increase snoring. It can cause anxiety, suffocation. It can cause a reduction in oxygen levels in certain susceptible individuals. And then there's a lot of pills and potions. Let me tell you what will work. Disregard everything else. Certain forms of magnesium, magnesium threonate, crosses the blood-brain barrier, can help with sleep. And if you're dealing with jet lag, melatonin can be helpful. Other than these two supplements, nothing else has really been shown to work.
And we were seeing a nose clip that people are wearing. What is that? Is that like mouth taping, but just for your nose?
Pretty much, and it's to prevent mouth breathing. The issue is that there's no data to support that it actually works.
Okay, so we do know. So when magnesium, you're saying in pill form, actually does help? How does that help?
So there's lots of different forms of magnesium. Magnesium threonate is what you want to look for, and it's a form of magnesium that actually enters the brain and will help relax you and does help with sleep. So that will work, and again, melatonin for those people that are jet lag.
All right, well, thank you for the advice. I mean, we really appreciate it, but everyone has been seeing that mouth taping and talking about it, so we appreciate hearing what you have to say about it. Dr. Nidhi Kumar, cardiovascular disease specialist, thanks again for being with us, and you can see our segments every Monday at 7:15 right here on CBS News New York.